This video is for outpatient providers and will focus on best possible medication history and prescribing medications. To access Web Ambulatory, please click on Web Ambulatory from your home screen. If you do not have this on your menu, you can also access it through the Web Acute status board. Clicking on the Web Acute status board will take you to this screen. You can use this drop-down arrow from your home button to toggle to Ambulatory Clinical home screen. Alternatively, if you clicked on Web Ambulatory, this would have taken you directly to your Ambulatory home screen. You will find your patient scheduled against you on your calendar here. Access the patient's chart by clicking on their name. To manage the patient's medication, please go to Orders along the top. Clicking on Orders, you will always be prompted with this warning message. Click on Go to Orders. From this screen, you will see Manage Medications by Name, and these are the patient's home medications. To reconcile this medication list, you would click on the Reconcile button. Once you click on the Reconcile button, you will find all the patient's home medication along the left-hand side. You will also find that there is a Confirm button, which will allow you to confirm each medication. You can click on Confirm All to confirm all medications. You can click on the bubble to add additional notes here, last taken date, and recorded dose. If this medication is no longer relevant for your patient, you can always click on the name of the medication and select Stop. And you will find a Stop button here. If there is a missing medication, you can click on the plus sign to add a new medication to the home medication list. Search for the medication and press Enter. You'll be provided with strings of medication. Select the closest medication string possible. Q to add it to your shopping cart, or Q and exit to leave the search box. When queuing, you will be prompted with the search menu again, and you can add a second medication if needed. Once you've completed this, you can also change the medication detail by clicking on the medication. And queue and exit. This will be recorded as the patient's reported medication. Once you are happy with the medication list, select Save in the upper right corner. This will display any changes to your medication list, and you can sign. This will be your home medication list. At this point, if you would like to prescribe any of this medication, you can. Select the medication in question that you would like to prescribe by using the chevron. The chevron will provide you with more information in the details. It will tell you the last confirmed date and who confirmed it. And you will also be given these buttons along the side here. You can see that is a reported medication. If you'd like to prescribe, click on the Prescribe button. Here you will be prompted for the number of quantity of medications, For example, 90 tabs. You can prescribe 90 tabs. Once you're happy with this, you can click on Queue and Exit. Alternatively, if you would like to prescribe a medication that is scheduled instead of PRN, you can choose duration. Selecting duration will change the quantity for you. "30 days equals 120 caps. Queue and exit once you're happy. If you're looking for a new medication to prescribe, please select on the Search Medications icon at the top. And you will be presented with medication strengths. Using the chevron, select the most appropriate strength. Queue and exit. The medication will now appear in green, and you can click on the medication to change any details if you wish. Once you are happy, click on the Sign button at the top, and you'll be presented with actions. You can print all the medications and submit the canceled medications. Clicking on the Sign button will take you to your print screen. Here you can print the RX for your medications. If you would also like to print a monograph, you can select that. And you can see that the monograph will be in English. Clicking on Apply will allow you to search for printers to print. Or you can preview all, then print. This will be your prescription, and you will sign at the bottom. If you are clicking on Preview to Print, please make sure you click on the printer and select your closest printer destination. Thank you.